Have you ever gone in for a routine medical checkup, expecting peace of mind, but walked out with more fear, more confusion, and sometimes even more tests? What if I told you that some of the most common checkups recommended after 60 may not actually protect your health and in some cases could quietly put you at risk? 3 of the tests I'm about to show you are done by millions of seniors every year. And they often lead to unnecessary treatments, stress, and wasted money. This is not about avoiding healthcare. It's about avoiding the wrong kind of healthcare before it's too late. I'm a doctor, and over the years I've worked closely with older patients who trusted the system, followed every recommendation, and still ended up worse than before. Not because doctors are bad, but because not every test is truly necessary, especially in seniors. Age changes how the body responds, how risks increase, and how small findings can turn into big problems. That's why today I'm going to walk you through 5 medical checkups I personally would never get after 60. So you can make smarter decisions, protect your health, and avoid unnecessary harm. Let's start with one of the most misunderstood tests out there. And the next one is even more dangerous. Number 1, routine full-body CT scans. This test is often marketed as a complete health scan. Many seniors believe it's the ultimate preventive tool, something that can detect problems early before symptoms appear. And on the surface, that sounds like a smart decision. But this is where most people make a mistake. A full-body CT scan exposes you to a significant amount of radiation. In fact, one scan can equal the radiation of hundreds of chest X-rays. Over time, repeated exposure increases your risk of cancer, especially as your body becomes more sensitive with age. So the very test meant to protect you could actually increase your long-term risk. I remember a patient in his early 60s who insisted on getting a full-body scan every year. He thought he was being proactive, but one scan picked up a small suspicious spot. It turned out to be harmless, but not before he went through weeks of anxiety, multiple follow-up tests, and even a biopsy. The emotional stress alone was overwhelming. Studies show that many findings in these scans are incidental, meaning they look serious but are not dangerous. But once discovered, they often trigger a chain reaction of more tests, more procedures, and more risk. This is called the cascade effect, and it's far more common than most people realize. What should you do instead? Focus on targeted screening based on your personal health history. Talk to your doctor about what you actually need, not what sounds comprehensive. Smart prevention is about precision, not excess. And the next one is something millions of seniors do every year, without realizing the hidden downside. Number 2, PSA screening prostate cancer test. Now this one is controversial, but extremely important to understand. PSA tests measure a protein in your blood that can indicate prostate issues. Many men over 60 are advised to take this test regularly, believing it will help detect cancer early. But here's where things get complicated, and this is where most people get trapped. PSA levels can rise for many reasons that have nothing to do with cancer. Infection, inflammation, even recent physical activity can affect the results. That means a high PSA doesn't always mean cancer, but it often leads to panic. And the next one is even more dangerous. A slightly elevated PSA often leads to further testing, including biopsies. These procedures are not risk-free. They can cause pain, infection, bleeding, and in some cases, long-term complications. Even more concerning, many prostate cancers grow so slowly that they would never cause harm during a person's lifetime, especially in older adults. I once treated a 67-year-old man who underwent a biopsy after a high PSA result. The cancer found was extremely slow growing, but the treatment that followed caused side effects that affected his quality of life far more than the cancer ever would have. Research shows that overdiagnosis is a real problem with PSA screening. Many men are treated for cancers that would never have impacted their lifespan. This leads to unnecessary procedures and avoidable suffering. What should you do instead? Have an informed discussion with your doctor. In some cases, monitoring may be better than immediate testing. Decisions should be based on your overall health, life expectancy, and personal risk, not just a routine schedule, because what we're about to discuss next is where things become even more surprising. Now let's move into the checkups that are often considered routine, but can quietly lead to overdiagnosis, unnecessary stress, and even harmful procedures, especially after the age of 60. Because as the body ages, the goal is not just to find problems, but to avoid creating new ones through unnecessary testing, and the next one is even more dangerous. Number 3. Annual stress tests without symptoms. Cardiac stress tests are commonly used to check how well your heart functions under pressure. Many seniors are advised to take this test every year even if they have no symptoms at all. It sounds like a smart preventive step. After all, heart disease is a major concern with aging. But this is where most people make a mistake. If you have no symptoms like chest pain, shortness of breath, or fatigue during activity, routine stress tests may do more harm than good. These tests can sometimes produce false positive results suggesting a problem where none actually exists, and the next one is even more dangerous. A false positive often leads to more invasive procedures like angiograms or even unnecessary stents. These procedures carry real risks: bleeding, infection, and complications that can impact your quality of life. In seniors, even small complications can become serious quickly. I once had a patient 70 years old, completely active and symptom-free. He took a routine stress test just to be safe. The results suggested a possible blockage. This led to further testing and eventually a procedure that he didn't truly need. The recovery was difficult and it limited his mobility for months. Research shows that in low-risk, symptom-free individuals, routine stress testing does not significantly reduce heart attacks or improve survival rates, but it does increase the chances of unnecessary interventions. What should you do instead? Pay attention to your body. If you have symptoms, get evaluated. Otherwise, focus on lifestyle, healthy diet, regular walking, and blood pressure control. Prevention is not always about more testing. It's about better habits, and the next one might surprise you. Because it's something many women are told to do every single year. Number 4. Annual mammograms after a certain age. Now let's be clear, mammograms can save lives. But after a certain age, especially beyond 70 or depending on overall health, routine annual mammograms may not always be necessary. This is where most people get confused. As we age, the likelihood of detecting slow-growing cancers increases. Many of these cancers may never become life-threatening during a person's lifetime, but once detected, they often lead to aggressive treatments like surgery, radiation, or chemotherapy, and the next one is even more dangerous. These treatments can be physically and emotionally exhausting, especially for seniors. In some cases, the treatment causes more harm than the condition itself would have. I remember a patient in her early 70s who underwent treatment after a routine mammogram detected a very slow-growing tumor. The treatment process was difficult and it affected her strength and independence. Later, it became clear that the cancer may never have progressed significantly. Studies suggest that for older women with limited life expectancy or other health conditions, the benefits of frequent mammograms may decrease, while the risks of overdiagnosis and overtreatment increase. What should you do instead? Make personalized decisions. Talk to your doctor about your overall health, family history, and life expectancy. Screening should be tailored, not automatic. Because what we're about to cover next is something almost everyone does without thinking twice. Number 5. Routine colonoscopies. Too frequently in older age, colonoscopies are widely recommended to detect colon cancer early, and yes, they can be life-saving when done at the right time. But after a certain age, especially beyond 75, routine colonoscopies may not always be necessary. And this is where most people make a mistake. Many seniors continue to undergo this test simply because they've always done it. But as the body ages, the risks associated with the procedure increase. Sedation, bowel preparation, and the procedure itself can lead to complications like dehydration, bleeding, or even perforation of the colon, and the next one is even more dangerous. Recovery from these complications is much harder in older adults. What might be a minor issue for a younger person can become a serious health event for a senior. I once saw a 76-year-old patient who underwent a routine colonoscopy with no symptoms. A complication during the procedure led to hospitalization. What started as a preventive check turned into a major health setback. Guidelines suggest that routine colon cancer screening may not be beneficial for everyone after a certain age, especially if previous tests were normal and overall health is stable. What should you do instead? Discuss your screening history with your doctor. In many cases, less invasive options or stopping routine screening may be appropriate, because now, it all comes down to what you do next. Now that you've seen these 5 medical checkups, the most important question is not just what to avoid but how to make smarter, safer decisions moving forward, because the goal after 60 is not to chase every possible test. It's to protect your quality of life, avoid unnecessary risks, and focus on what truly matters for long-term health. This is where most people make a mistake. They believe that more testing automatically means better care, but in reality, too much testing can lead to overdiagnosis, unnecessary treatments, emotional stress, and even physical harm. The key is not more healthcare. It's the right healthcare at the right time, and the next step is even more important. Let's turn everything you've learned into a simple, practical action plan that you or your loved ones can start using immediately. First, always ask one critical question before any test. Do I really need this test based on my symptoms, age, and health condition? If the answer is unclear, don't hesitate to ask for clarification. A good doctor will always explain the purpose, benefits, and risks in simple terms. Second, focus on symptom-based testing instead of routine testing. If you feel well, active, and stable, not every yearly test is necessary. But if your body is giving you signals like pain, fatigue, or unusual changes, then testing becomes important and targeted. Third, understand the concept of false positives. Many tests can show something abnormal that is actually harmless, but once it appears, it often leads to more tests, more stress, and sometimes procedures you never needed in the first place. And the next one is even more powerful. Fourth, prioritize lifestyle over lab reports. Your daily habits, what you eat, how you move, how well you sleep, have a far greater impact on your health than most routine screenings. A 30-minute walk, balanced diet, and proper hydration can do more for your heart and body than unnecessary testing. Fifth, always consider your overall health and life expectancy. Not every screening is beneficial at every age. After a certain point, the risks of finding and treating slow-growing conditions may outweigh the benefits. This is a conversation worth having with your doctor. And here's something most people don't realize. Sixth, build a relationship with a doctor who understands personalized care. Not every recommendation should be one size fits all. Your health plan should be tailored to you, not based on general guidelines alone. Now, before we finish, there's one very important warning. Do not stop any medical test, treatment, or medication without consulting your doctor. This video is not about rejecting healthcare, it's about making informed, smarter decisions. Always discuss changes with a qualified professional who knows your medical history, because at the end of the day, your health is not just about avoiding disease. It's about maintaining independence, energy, and peace of mind. And if this video opened your eyes even a little, I want to hear from you. Comment below. Have you ever gone through a medical test that turned out to be unnecessary? Or caused more stress than benefit? Your experience could help someone else avoid the same mistake. And if you care about your health or the health of someone over 60, make sure to subscribe to this channel, because here we break down complex medical topics into simple, practical advice you can actually use. And the next video might surprise you even more. We're going to reveal 7 common medications seniors take every day that could quietly damage memory and brain function. You don't want to miss that, remember. The smartest health decision is not always doing more, it's knowing what to avoid.